So May is Women's Health Month, and joining us today to talk more about health issues facing women, Dr. Samina Rahman. Dr. Rahman, I'm so glad you're here because, you know, a lot of times women are taking care of everyone in their lives.
Absolutely.
It's important that we take care of ourselves as well with the preventive stuff, like going to the doctor.
Absolutely. I think one of the biggest things that we always talk about is self-care, but real self-care is actually, taking the time to get your health checked out. We have to get in for our annuals, we have to get our pap smears and all the cancer screening done. We need to make sure that, our heart health is great, which is still the #1 killer in women. So it's really important for us to take care of our own health, because if we don't take care of ourselves, we really can't take care of anyone else either.
So I know your expertise is really in menopause.
Absolutely.
We do not talk enough about menopause. Why is that? Why isn't there more research into what can be done to help women during this transition?
Yeah, absolutely. I mean, we're doing a little bit better these days by doing some research, but absolutely there's not enough research in most topics around women's health, but particularly midlife women, particularly sexual dysfunction and those issues around that. And I think it's because, sometimes in the past, at least historically, women just felt like they had to kind of just deal with it and go through life, right?
Right.
There was no
Quietly,
right? You didn't have to. There wasn't anything that was going to improve your quality of life. But we have many ways of improving the quality of life of midlife women.
Talk to us about some of the treatments that are available that we should be asking about when you start menopause.
Absolutely. Hormone therapy, of course, sometimes gets a bad rap, but it's still the best, overall treatment for women who can take it. And so, you have to have a qualified clinician that can walk you through, if this is the correct medication for you. But hormone therapy across the board, which is estrogen and progesterone, or estrogen alone if you don't have a uterus, can overall help the quality of your life by not only improving vasomotor symptoms, it can help with your brain health, it can help with your heart health, with your bone health. So I think that is really a critical component. There are other medications that can help with vasomotor symptoms. We know that women that have untreated vasomotor symptoms, which are your hot flashes and your night sweats, actually have worsening heart disease and, actually diminished longevity. And so it's really important to get that treated.
Yeah, and I want to talk about some of the other health concerns that we need to be thinking about. You've mentioned heart disease a couple of times.
Yeah, absolutely. Heart disease is still the #1 killer in women, and we know it goes up after menopause for a lot of women. So it's a matter of really just even knowing, even if you're not in that age range, but you're experiencing issues that may tip your gynecologist or your clinician that maybe you have polycystic ovarian syndrome, and we know that's going to increase your risk for metabolic dysfunction and heart disease later. Even, in your 20s and 30s, you can find ways to kind of prevent this later in life. And if you're getting, routine checkups and getting, your cycles checked out and everything like that, then it can be very beneficial for you.
Mental health.
Absolutely. This is a big problem for a lot of women: depression, anxiety. Particularly, the two areas that I work in are the 4th trimester, the postpartum mental health issues that come up really around those hormone changes, as well as the perimenopausal and, postmenopausal anxiety, depression, and cognitive changes that happen. A lot of that is, we don't talk enough about the fact that, we have a woman in her midlife who's at the pinnacle of her career, or maybe like taking care of family, maybe taking care of kids.
Aging parents.
That sandwich generation. And all of a sudden, they're not able to remember the next word because of brain fog, or they're in the middle of a big meeting as the CEO and they're talking and they can't remember, the next statement they were going to make. And these are all related to these hormonal transitions that happen. And all of this can really inhibit not only the quality of their life, but also, impact their workforce and relationships.
Dr. Rahman, so much good information there. Thank you for coming in this morning. And for more information on the Center for Gynecology and Cosmetics, check out their website. It's at CGC, I should say, cgcchicago.com. Also follow Dr. Rahman on social media. She's on all the platforms, and you can find out about her upcoming events focused on menopause as well.
Yes, absolutely.
Great.
Thank you so much.
Day's top stories coming up next.